Welcome to the Doctor's Lounge with Ivy and George.
We invite you behind the scenes in healthcare to promote transparency and good conversation in medicine. So welcome.
Come on in.
Now, today's topic is going to be...
It's a serious one, but it's a conversation we need to have.
It's about death.
One of the things that in our jobs as physicians, we often deal a lot with death, and especially we're both palliative doctors. So we see in those moments that a lot of times people aren't ready to go through the conversations and the experiences. And there's some things we wanted to help give people a framework and a guide for how to have some of these conversations and how to be there for people when someone's dying.
And I will say grief and loss, it's never easy. Having lost people myself, especially when I was younger, and now with so many patients losing them. I mean, we build connections with our patients and families. I don't think it ever gets easier. Yeah, the weight of emotion. With time, I think grief is more tolerable. The good news is that there are ways to make it less hard.
While every specific situation is unique, there are commonalities and there's things that we can know and that can help navigate this process. And especially, one of the things, because we as palliative doctors really focus on communication, there's things that can help for family members, especially, or anyone, friends, people whose loved one is dealing with a serious illness, things that can be good to know to help them have communication and make the most of whatever time they have left. And so that's one of the things we really wanted to share.
Yeah, we will all leave this earth one day, and it's inevitable. If we have tools to help normalize the situation, can be immensely helpful. I think what we see a lot with people struggling, we don't really normalize death in our society really well.
And I think especially patients feel isolated. And one of the things I've seen in the hospital, a lot of times you'll notice that, like, if someone gets a new big diagnosis, let's say a cancer or something like that, even sometimes some of the physicians may feel uncomfortable, may kind of give space. Family and friends care, but like they don't know how to interact and they don't want to say the wrong thing and they back away.
I think for providers, that's a great point, that it is tough as well. I think recognizing our own emotions, dealing with how do we accept death.
Well, and I think part of it too is the patient or the individual going through this diagnosis already feels scared, alone, isolated. And so they'll pick up on any little thing. So if they'll pick up if people feel uncomfortable around death, and they'll feel more isolated. So then that causes those elements that causes that feeling of being alone, which they're already dealing with so much from a health perspective. That's like the worst thing that could happen there. So I know that's one of our goals, is to help people. If you have a loved one or someone going through things, little knowledge to how to be there for them, so you can just support them, because it is a tough time, and it's a tough time for everyone. But that's one of the things we definitely wanted to help share.
I think that's our number one part of the framework. Our number one thing is being present, and that looks like allowing the space for the person who's going through the illness to be fully themselves. They may be angry, they may be sad, they may be scared, but sitting with that and not abandoning them, recognizing that it's part of the illness itself, because all these changes happen metabolically within the body and the brain chemistry. Your loved one may not be themselves, and we can talk more about that in the second part, which is being informed, what it looks like.
Yeah. And I mean, I think for the being present, a big part of it is nowadays, especially with our culture, with society, people are always on their phone doing 2-3 things at once, not really engaged. And it's like, that's the reason we have so much feeling of isolation as it is. But especially in these serious moments, that being able to be there with someone, even if you're physically not there, but even being there on the phone, listening, not trying to rush off the phone, but kind of like just sitting with it, because it is uncomfortable. It's an uncomfortable feeling. You feel bad, they feel bad. You don't know what to say. Like, it's there, but it's like just that presence, that, taking their hand or some sort of thing like that can really be powerful and help make that time feel a little more meaningful.
All moments have meaning, even though moments at end of life.
Yeah.
There's a common question that we get, should I be there with my loved one as they die? Some people are there, some people are not. I always say there's no right or wrong. It depends on the relationship that you have with the person.
Yeah.
Like, what if they could be telling you, what would they be telling you? Are they a private person? There's a certain amount of dignity and
Yeah.
vanity, not in a negative way, but do they prefer to be not seen or have a small group of one or two
Yeah.
people? Or were they about being social and wanting to be
Yeah.
surrounded by large groups of people and loved ones? I think it really depends on knowing them and knowing what they want. And these conversations are tough regardless, but having conversations and understanding your loved one's preferences. If I may share, your mom said, this is the, song I want, and the psalm
Yeah.
read
Yeah.
from the Bible.
Yeah. When a lot of these conversations, it's necessary but upsetting. I remember just like this. So my mom told me even once when we were going, she's like, "Look, she's like, if God forbid, if it ever happens, I don't want to be on machines like this." And I'm like, I don't want to like you. In that moment, I was as a son, but she was like, "Well, I'm telling you, I told my brother, you guys need to know because if it comes up, it clicked." And then the doctor part of my brain is like, "Okay, I get it." Oh, the things they don't want. It's like scary. It's scary to hear, it's scary to think about, but it's
It's hard
also
for, yeah,
yeah,
loved ones, of course. It's such a gift that your mom, your loved one gave you
yeah,
to explicitly share what they wanted. I think
yeah.
even then, of course, it's difficult in decision making, but
But it makes a difference because when you get in those moments, if you've never had those conversations, it's easy for people to feel a guilt or a weight as if I'm doing this to them. And so even a lot of times I'll talk with families and say, like, "Look, first of all, everything is medical. We as medical providers are giving recommendations, we're giving discussions, but like to take off that it's not anything you're doing, and even it's not something we're doing, it's the disease process that's going through. So it's like to not have that guilt feeling of like, oh my God, we said this. It's like that's not the case. It's
well,
just
we also know talking about death does not hasten it. I think a lot of the times we hear from people, I don't want to put out negative energy. I don't want to talk about
yeah,
something if I remain positive that this is how I'm going to heal. Talking about it will take away hope, that
yeah,
it will, start depression. There is a sensitivity, a way of communicating serious illness,
yeah,
and that we need to be mindful. And absolutely, there are times where people are not ready
to have the
to
conversation.
have the conversation. Of course, we need to absolutely
Yeah.
respect. I do challenge the thought that having the conversation, honestly, I've had experiences where having the conversation actually brought relief, and it almost made it less scary because it didn't happen, and it almost empowered them to face something
Yeah.
that is so hard.
Well, and I mean, I think part of it, it's that thing we all know that like the uncertainty and mystery is more scary, more upsetting, more stressful than the reality. It's like,
For some.
when you're waiting for a result from something, the moment in between is the toughest one. Once you know whatever it is, good, bad, then you can, okay, come up with a plan, do something. But it's the waiting, which it makes it more the uncertainty, it seems even bigger than whatever it really could be. So like, I agree with you. That makes
Yeah.
sense
And
to
that's, of
talk
course,
about it.
there are people of faith, and there's some people who know for certain.
Yeah.
And we've seen that bring a lot of solace. It doesn't always bring solace. Faith doesn't always do so. So I think we've seen a variation of how people experience the process.
It's like the saying they have that, like, if you've seen one, you've only seen one. Like, it's like, each one is its own thing. So, like, whereas there are trends and things that are
We,
broader, work for a lot,
yeah,
there is that situation that, like, everyone is their own unique thing. So, like,
yeah.
some people will gain benefit from something, some won't. And that's part of that being mindful and understanding and that flexibility that comes up.
And we really hold being part of that space and people's journeys with such sensitivity.
Yeah.
It's such an honor to be part of people's lives
Well,
and having a window to what they want to share with us. So we don't take that for granted.
I mean, for me,
And we really honor, every
yeah.
person that we care for.
Well, like for me, a big part of it is that because I know there could be so many issues, complications in the medical system. And so being there to try to help people and families navigate it and try to help find what's the best thing for them in the situation we're in. Because sometimes it's like sometimes we don't have good options. We have two bad options, but
Yeah.
once you know what they are, I say often, like, I feel like I translate medical to English, like try to like help them know what's happening. And then once they know, whatever they decide,
Yeah.
we can support. But it's like you're coming in clear eyed, like you understand what the reality is.
I always say, how can we make a hard thing less hard?
And
So,
so the second point, like you're saying, so
mhm.
the first one is being present.
Being present. And what I want to share is that there are a lot of people alone in the sense they're not, of course, they have their medical teams, but they don't have family or they don't
Yeah.
have any loved ones. We've seen so many people.
Yeah.
That also has to do with access to care
Yeah.
as well. It's the intersectionality of socioeconomic complexity, wide range of things why that would happen. But there are people called death doulas and volunteers that actually sit with people
Mhm.
who don't have anyone. They sit with them for long periods of time, sometimes even 24/7, to be a supportive presence. And I think that could be really meaningful and powerful that the medical space can provide that sort of resource for people that are alone. Like, no one should have to die alone,
Yeah. Yeah.
especially if that's not their preference. I'm getting choked up just talking about this
Yeah.
topic.
The first step in the three-step process, one was being present, two is being informed,
Being
and
informed. So I think a lot of the times people die in the hospital. They're on medications,
yeah,
machines. Death doesn't look normal or
yeah,
peaceful, or sometimes people even don't know what does dying look like. And part of it is fear. They don't necessarily want to know,
yeah,
right? It's too hard for them to
yeah.
watch their loved ones.
There's sometimes certain breathing patterns we could see, or sometimes certain fluctuations in aw
Color,
color and
pulses.
awareness. Even like one of the things we'd say sometimes, like often people have something we call like a rally, which is closer to the end, they'll, maybe they're more confused, more out of it. And then they have a really good day. And everyone, people get excited and hopeful that, okay, this means they're turning a corner. And sometimes they could, but also sometimes it's that last gasp rally kind of thing where it's a very
There are
clear,
yeah, right. There are good days and bad days as we
yeah,
share. Like, some people are more engaged sometimes and some people are less, and
yeah,
that fluctuates. Hold on to the good moments when
yeah,
they come, because
yeah,
with time sometimes it's few and far between. The question comes up about medications. Now, medications are there to ease any suffering. We know that end of life, like you said,
yeah,
depending on the disease, can really be a struggle as the body is sort of changing. There can be fluid in places we don't want, like in the lungs, and that can literally cause somebody to gasp for air. And thankfully, there are medications to help ease
yeah,
that. Now, I will share sometimes people are scared that medications will
yeah.
hasten death. What are your thoughts? I'm curious on that.
I mean, for me, like both through training and then through firsthand experience, I know like when someone's close to the end, a lot of times, especially based on the disease, but most it's the disease process that's driving it. So if it's cancer, if it's um if it's something, especially people who are like qualifying for like hospice, end of life, or some of these other things, like if they're sick enough that they're in the hospital or in a location where they're needing lots of medications to treat their symptoms, it's not the medicine that's causing a lot of these issues, it's the disease. And with the medicine we try to treat the symptoms. And while there are side effects, we know that our goal is treating symptoms, not hastening anything. It's
Right. We
treating it.
use doses in amounts where it would match the symptoms. We call it dose dependent.
Well,
People, just like giving birth can be a natural process, I think dying can be a natural
yeah,
process. And peop the last point we want to share, which is the third thing, is to really hold on to those good moments. And we share that it's finding beauty. What we mean by that is those moments are beautiful and to be treasured,
And I think
and they're
especially,
still living.
yeah, when especially because death is universal, we're all going to die, and we know that we have a finite amount of time left on earth, especially in those moments when you know it's getting closer. There are special moments between family members to communicate, to make peace, to have those special things that can come together. One of the doctors I've worked with before was saying there's a lot of times there's certain things, at the end that we can do where it's like tell someone thank you, tell them you love them, ask for forgiveness, and forgive them for things they've done. And
That's the four things that matter is the book.
it sounds very simple, but in those moments, it helps patients feel that peace and beauty. It can help family members feel it, and it can allow for that connection because ultimately all this is coming because we love one another. We're there for each other. You want to make let them know that how much you appreciate them and how special all the time is. And in those little moments, you then get another bit of that beauty of being able to say goodbye because it's like if you don't do that, people could and will still pass away, but you're left with regret or grief or suffering above and beyond what maybe we could allow to happen. So that's where those little things that can help bring about that beauty. The same that, those discussions, those inside jokes between loved ones that can bring a sense of,
I often reflect on mortality and the finality of time. We're bearing witness
yeah,
to a lot of serious illness and suffering, and it always makes me think how I will lose you one day. So to cherish the moments that
yeah,
we do have, and we love doing this also, just
yeah.
speaking about our profession and what we do. And this was uh, a way to bond in a different way.
I always value the work we do being there for people in these moments, but it also, when we're talking all the time for patients and families about what means something to them, when I then also think for myself, what is meaningful to me. And I know, my amazing wife, I know the work I get to do, being able to be there for people, the lives we're able to live, like those are the things that I'm appreciative of, thankful for, and I want to be able to enjoy because we know that these are the things that are important. Like that's the stuff you remember. It's
Yeah,
like,
the small things are the big things. The things that I remember years ago or the trips that we went on.
well, and it's like those are the moments you remember. And
YOLO, go on that trip,
we
buy the car.
well, we went to college together, and so like I often will remember like we would do like late night while studying, like late night trips to Taco Bell and
Yeah,
like in the car and go. And so like those are the moments that
that we
you
remember.
remember that stick with you. Those are the times that you feel like even little thing. We have a little picture frame with like digital, some of our pictures are going through, and it brightens my day to walk in through the door and see like old pictures that we have together. The same when someone's seriously ill or close to death, of that like finding those little things
That
that make
matter. And it doesn't, you may have someone that you feel that way with. You may also have a project or your work or something you create that really ignites your passion and love. That is really special. Something that brings joy is so special.
and I think ultimately that's what this episode is truly about. Love, the things that bring you that joy in your life, and holding on to the things that you find meaningful.
We hope that this framework really offers some guidance if you know somebody that's going through a serious illness or are transitioning to dying.
Thank you.
Right. Thank you. Bye.